You've probably heard of ultrasound scans, perhaps during pregnancy or when investigating pain or a lump. But did you know the same painless technology is used almost every day to look at almost every organ in the body, from your heart and kidneys to your muscles and blood vessels, all without a single drop of radiation? I'm Dr. James O'Donovan, a licensed UK medical doctor, and I've performed both ultrasound scans as a doctor as well as received them myself as a patient. In this video, we're going to explore what an ultrasound scan is, why it's used, how to prepare for one, including when you might need to have a full bladder, and what to expect on the day of your scan. As always, this video is for general education and it is not a substitute for personal medical advice. So firstly, what is an ultrasound scan? Well, an ultrasound scan uses high-frequency sound waves to create real-time images of inside your body. These sound waves bounce off tissues and organs, and a computer converts the echoes into moving pictures on a screen, which the person performing the ultrasound can interpret. Now, because it uses sound rather than radiation, ultrasound is one of the safest and most commonly used imaging tests. It can show soft tissues that don't appear clearly on X-rays, such as muscles, tendons, and internal organs, and it's entirely painless. So why might an ultrasound scan be done? Well, doctors use ultrasound scans for many reasons. They might help investigate unexplained pain, swelling, or a lump. They're used to check organs like the liver, the thyroid, the kidneys, the testicles, and many others, and to guide procedures. So, for example, injecting steroid into a joint. Now, ultrasound is also vital in pregnancy to monitor a baby's growth and development, confirm the baby's position, and check the placenta as well as fluid levels. Now, in short, ultrasound helps doctors see inside your body safely and instantly, often giving answers there and then. So if you have an ultrasound scan coming up soon, how can you best prepare for it? Well, your hospital or clinic will tell you exactly how to prepare, but some scans need specific steps. So for example, if you're having a scan of your bladder, your abdomen, your womb, or your pelvis, you'll usually be asked to drink several glasses of water beforehand and avoid going to the toilet. A full bladder helps to lift the bowel out of the way, and it gives a clearer picture of the organs behind it. Now, for other scans, such as those of the liver or the gallbladder, you might need to avoid eating for a few hours beforehand so that your stomach and intestines aren't full of food or gas, which can make the image less clear, but you'll be given specific instructions. Now, you may also be asked to remove jewellery or piercings near the area being scanned, and if you'd like someone with you, such as a friend or a partner, you can request a chaperone or bring someone along. It is entirely your choice. Now, what happens during the scan? Well, an ultrasound scan is usually done by a specially trained healthcare professional called a sonographer. You might be asked to change into a gown or simply move clothing away from the area that is being scanned. Now, for most scans known as external ultrasounds, you'll lie or sit on a couch next to the ultrasound machine. A small amount of gel that feels like cold, clear jelly is applied to your skin to help the probe glide smoothly and to allow sound waves to travel more effectively. The room lights are often dimmed so that the sonographer can see the screen more clearly. The probe is then moved gently across your skin, showing real-time images of your organs. You might be asked to take a deep breath or to turn slightly to help guess the best view. Now, the test usually takes between 10 and 45 minutes depending on what the scan is of and how much there is to see and report on. And when it's finished, you can wipe off the gel, get dressed and carry on with your day. Now, an important point to note is that whilst you might want to know the results there and then, and whilst the person who is performing the test usually has a good idea of what they're seeing, you won't likely get the full findings until later on in a written report, so please do be patient. Now, sometimes a clearer picture is needed of internal structures such as the womb, the ovaries, or the prostate. In these cases, the sonographer may perform what we call an internal ultrasound, using a thin, smooth tube that is shaped and inserted into the vagina or rectum. Now, you'll be covered with a sheet for comfort and privacy, and lubricant, which is jelly, is used to make the procedure easier. It shouldn't be painful although it can feel a little uncomfortable or pressurized at times. Now, you can ask to stop at any point or even insert the probe yourself if you prefer. Remember, you're always in control during the scan, and you can always have someone else in the room if this helps to make you feel more comfortable. So now let's talk about after the scan and getting results. Once your scan is complete, the images are reviewed by a radiologist or the sonographer. Sometimes you'll be told the results immediately, like I mentioned, but most other times they'll be sent to the doctor who referred you. For routine scans, especially in pregnancy, a written report is usually added to your notes. Now, if you don't hear anything after a few weeks, you can always contact your doctor or the specialist who referred you to check your results and discuss what happens next. Finally, let's briefly talk about safety and potential side effects. Ultrasound scans are extremely safe. They don't involve ionizing radiation, and the sound waves used are not harmful to you or your baby. Now, external scans are painless, although they can be slightly uncomfortable if the probe presses on a tender area. Internal scans can feel slightly awkward, but your comfort and consent are always the priority. If you do feel pain, you need a break, please let the sonographer know and they will stop immediately. If you found this video helpful, please feel free to leave a comment. If you've got any questions, please also post them in the comment section and I will get back to you. And now, why not watch this video next?